Direct nerve involved with endometriosis is extremely rare.
Endometriosis, leg pain, and nerve involvement. This is a big, I see it always on social media. Sciatica, pain shooting down from the hips into the thighs and the legs, numbness and tingling, even mobility issues. And also, this pain can either be new or worsened after surgery. So, in your experience, what are the possible causes for leg pain with endometriosis?
Okay, it's a very good question, very good debate on this as well. So we know that leg pain is very common association with period pain, and it does not mean there is a nerve or sciatic nerve endometriosis. Okay, so if you imagine the pelvis is a structure which is supplied by multiple nerves, we have few main sort of main nerves, and they're branching into a network which is called inferior hypogastric plexus, for example, for the pelvis. And this network of nerves supplies everything from viscera like bowel and bladder and everything which goes there. If the tissues around the big nerves, for example, supplying the legs or the pelvic muscles or the lower pelvic structures are involved with peritoneal inflammation, that pain can be referred from pelvis to the legs. It doesn't mean there is a huge endometriosis on sciatic nerve. Sometimes it is. In this case, MRI will certainly see that. But most of the time, the leg pain and suspected nerve involvement comes with a negative MRI. And for these cases, we assume that this pain is to do with inflammation, and this pain is referred to the nerve rather than caused directly by compression of the nerve or sort of endometriosis growing into the nerve or something like this. Also important part of this pelvic pain is dysfunction of pelvic floor muscles and other pelvic muscles as well, because when you in pain you instinctively start to position your posture and preserve some of the movements. You sort of change how your pelvic muscles work as well, and that can result in muscle spasms, which is independent source of pain, and it becomes very complicated. So you have to have a full sort of neurology assessment sometimes to understand what's going on and which nerve is involved.
So there's a lot more to it than simply you have endometriosis on your nerves.
Direct nerve involved with endometriosis is extremely rare.
That should bring a relief to many women because, as you're aware, the pain perception is heightened in many women with endometriosis, and they're almost convinced that it's hitting a nerve. But you're saying it could be associated with nodules on the pelvic wall or inflammation created by lesions that's irritating the nerves.
That's right.